We know there is a really high carbon footprint for metered dose inhalers, in part due to the hydropropellants that they contain. And so there's a big push both nationally and regionally to move towards greener inhalers. We know that for using 2 Ventolin Evohalers in a year, the carbon footprint is the same as that of doing 199 miles in an average car. That same figure for Salamol is 85, and for a Ventolin Accuhaler is only 4. We see similar stark differences between metered dose inhalers and dry powder inhalers when we look at preventer therapy as well. So from the data that we've looked at, we found that there is potential for huge reduction in carbon footprint of over 90%, but that this would come with a cost increase of just over 30%. We are aware that we've only looked at the data for children aged 5 to 12 years in our severe asthma clinic, and so far we haven't looked at the data for children aged over 12. We don't know if the same sort of figures would be reflected in that age group. We may see more use of medications such as Spiriva Respimat, and the potential for change and reducing the carbon footprint isn't as great with those sorts of medications. We're also aware that these patients are from a regional severe asthma clinic, and that many more children with asthma are managed in general paediatrics or in primary care. And we can't extrapolate all of the data that we see in our population to the whole of the paediatric asthma population. Other things to think about are that so far there's very little information out there on device efficacy in children. Any change of device would need consideration of patient preference and an assessment of their technique with new devices. However, with such a scope for change, it's something we need to take seriously. The cost of these changes needs to be considered beyond that of the basic prescribing costs we've presented. We don't know the impact, if any, on asthma control, the need for admission to hospital, and the impact on the frequency of outpatient reviews and nurse education needed. We also need to consider these prescribing costs in the wider context of sustainability, pollution, and air quality, and how all of this relates to the longer term implications of the respiratory health of our children. We also noticed that some of our patients remain on Ventolin Evohalers, and these have the biggest carbon footprint. Switching these to Salamol, which is actually 4 pence cheaper per device, would be a straightforward way to start reducing carbon footprint. So even if we aren't in a position to start making those bigger changes over to dry powder inhalers, this simple switch, alongside reminding our patients and their families about recycling and appropriate disposal of their inhalers, and checking in for overordering of salbutamol, are simple things that we can all start doing to reduce the carbon footprint of inhaler prescribing.